Hi everyone, welcome to today's episode of Pregnancy Gyan. Let us learn today how your personal information can be an indicator of risks to your and your baby's health. Let me start from your name. As you know, the names of a person are usually specific to the region they come from. Also, name is a very good identifier of a person. In our hospital, we always insist that there should be at least two identifiers for every patient, and we urge patients to identify their papers by those identifiers. For example, name and their registration number, name and their phone number, or name and their date of birth. And thus, it is very, very important that you provide your official name, check your spellings, and make sure that they are entered correctly in the forms by our personnel. The next thing is usually date of birth. And you of course know that date of birth is an important marker because many outcomes of pregnancy are based on your date of birth. Similarly, for non-pregnant patients, there are so many factors which can be affected by your age. So it's essential that you provide your actual date of birth, because sometimes I have come across people who have a different official date of birth and actual date of birth. You'll be surprised to know that your address also affects your health. For example, in COVID times, there were areas which were demarcated as red zones. So, for doctors, they keep getting notifications about the communicable diseases which are more prevalent in certain areas of the city, and it's important that you convey your correct address and update it from time to time with your healthcare provider. How about profession? Again, professions impact your health. So they can impact your unborn baby's health too. For example, a computer professional is at risk of backache, increased weight gain in pregnancy. Due to lack of exercise, they may also have mood changes, depression. Their jobs are very stressful at times, so there could be emotional disturbances. They are also at risk of neck pain, back pain, and as the pregnancy advances, a long sitting job like theirs can increase their risk of blood clots in the legs. It's important that if you're pregnant and a computer professional, to make time for at least 30 minutes of exercise every day, focus on your diet, and very, very importantly, focus on your water intake. Make sure that you drink around 1 cup of water every hour, and you take a walk of at least 5 to 10 minutes to stretch your legs every couple of hours. This will make sure that you stay healthy throughout your pregnancy. Remember, Indian pregnant patients are anyways at slightly increased risk of gestational diabetes, high blood pressure, and nowadays, as the age of first pregnancy is advancing to 30 and beyond, there is further addition of these risks to the pregnant patient and thus to the unborn babies. Please make sure that you do not put on too much of weight during pregnancy. We are going to keep talking about different professions and how they impact your health throughout. Now let us move on to the further information. Beyond your personal details, we also take your partner details, we take your family history, and sometimes your partner's history as well. It will be a great idea to come with all these details when you are coming to the hospital, so that it saves time for you and gives accurate information to your healthcare provider. Moving on, We'll be taking certain important measurements like your height, your weight, your blood pressure on both the arms twice, and that gives us more insights into your overall health. If there is any information which you want to tell us, you are more than welcome to tell us with your family or even in person, because every small bit of information makes a huge difference to the outcomes. Trust us, your information will be strictly used for professional purposes to better your health and, with your permission, sometimes to advance the medical research without sharing your personal details. Thank you so much for cooperation. Make sure that you fill up your form diligently and carefully. Take care. Happy pregnancy.